Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world, to help you make informed decisions to live your best life.
And today, we figured with the change of administrations, we thought it'd be a good time to look back on the Biden presidency and notably his achievements in the area of health policy relevant to our listeners with chronic disease.
Yeah, love him or not, Biden did do a lot in the health policy world that deserves mentioning as he exits stage left, so to speak. So let's get into it. There's probably three main areas where the Biden presidency was felt in the healthcare realm. I mean, there's a lot more we could discuss, but we'll stick to the three biggest that he did, which was COVID-19, opioids, and the Inflation Reduction Act.
Yeah, COVID, that's a big one. I mean, just like think about where we were 4 years ago. It's January 2025. We were January 2021. I guess like we were just on the cusp of getting vaccinated. People had started to get vaccinated, healthcare workers. COVID was raging. We were still wearing our masks, very worried about what was going to happen, especially our community who's immunocompromised, the elderly. It was amazing to finally have, the success of the vaccine.
Yeah, no, absolutely. President Biden took aggressive actions against COVID-19, most notably for the mass vaccination campaign. There was a pretty comprehensive report done by the Commonwealth Fund that estimated that based upon the mass vaccination campaign, getting the shots in arms, as we called it back then, we saved an estimated 3.2 million American lives, which is worth celebrating, to say the least.
Absolutely. And, as we talk about this too, an important part of this was President Trump and Operation Warp Speed to get the vaccines, to develop them. But we do know that the vast majority of injections was an undertaking during the Biden administration. So thank you to the administration for saving what you just said, an estimated 3.2 million American lives. That's like the best data you can have in hand, especially now as we're combating a lot of misinformation and declining rates of vaccines. It's important to highlight that.
Yeah, no, definitely. Within just a few months of taking office, I think, as my recollection is correct, nearly all eligible Americans were vaccinated. Not everyone took one, but all, within a relatively short period of time, we were all, at least had the ability to be vaccinated, and most of us were. And perhaps just as important, development of vaccines continued so that boosters could be provided in the coming years as needed.
Absolutely. And just taking it to today, we are in an entirely different place, a much better place. While COVID is still a threat and circulating, it is definitely different than how we were in January 2021, and for the better.
Absolutely. So moving on from COVID, let's talk a little bit about opioids. Not a subject we talk a lot about here, but certainly a crisis that has afflicted much of our nation for quite some time. When Biden's term started 4 years ago, the number of overdose deaths was skyrocketing at 31% a year. The administration's overdose prevention efforts contributed to a reversal in that. The CDC reports that the year ending last June, the fiscal year ending last June, saw a 14.5% decrease in overdose deaths. That's the single largest recorded reduction in U.S. history. That's also the first time since 2018 that the country has seen a decline.
Yeah, so let's dive into this. Like, how did we get to this reversal? What actions did the administration take?
Yeah, I think one of the most important actions that they took was to make Naloxone, which is an opioid overdose antidote, available over the counter. That's a really, really big deal. Essentially, you don't need a prescription to obtain and carry around with you. Essentially, a medication that can be injected, or I think it's through a nasal spray, when someone is having an overdose. So loved ones are able to simply go to your local pharmacy, pick it up, and just have it on hand as needed, and not necessarily rely on emergency medical services to appear on time. And that has surely contributed to the decrease in deaths, which is a big deal.
Absolutely. I mean, no one ever expects that they're going to be in that scenario where they're going to need, a fast-acting antidote like Naloxone, and just being able to have it in your purse, in your pocket, readily available without the extra barrier of getting a prescription. Like, you can just imagine how often you have stuff going on in life. You'll say, maybe if you're interested in getting one, but you would delay it. And now it decreases that. I got to do all these steps and there's all these barriers. You could have it. And if God forbid you're in a situation, you can administer it easily. Like you said, it's a nasal spray.
Yeah. The administration also removed roadblocks to treatment access. For instance, a longstanding requirement for providers to obtain a license called an tax waiver to prescribe a highly effective medication used to treat opioid addiction made it difficult for people to find doctors who could prescribe this very important treatment. So 2 years after Biden lifted this, what I would argue, unnecessary requirement to obtain this waiver, the number of eligible clinicians went up 15 times. So that's a pretty big deal.
Yeah, I think, overall, these are just really good examples at taking a look at how we currently structure and do things and thinking about how to eliminate barriers to just make treatments and access to care more easy for people to get to.
Definitely. Speaking about access to care, the administration also made permanent some telehealth provisions that made care more accessible and changed regulations to allow people in jails and prisons receive addiction treatment, which was helpful. If you're able to recover while incarcerated, when you come out, you're less likely to obviously have an overdose death. And perhaps almost as critical was decreasing supply. The U.S. seized more illicit fentanyl at ports of entry in the last 2 years than in the previous 5 years combined. So that's a pretty impressive feat, and it's good to see those who paid any attention to the opioid crisis know the dangers of fentanyl. We won't get into the details of that, but stopping these at ports of entry has been a really big deal.
Absolutely. And last on our list, we have the Inflation Reduction Act, the IRA. I'm pretty sure we've done some episodes on this. We won't dive too deep. And while we know that there's challenges with it, we also know that there's a lot of great stuff for patients in the IRA as well.
Yeah, absolutely. And this was, to quote President Biden, a big effing deal. And it had some provisions that we might have quibbles with. But, it is a big deal on the healthcare system as well as in other areas too. Some of the positives to highlight: Biden fulfilled a campaign promise to cut prescription drug costs for seniors. Specifically, the IRA contains provisions to make it easier for older adults to afford medications. And the most notable is a cap on out-of-pocket spending for those enrolled in Medicare Part D.
Yeah, so previously the annual cap was $3,500 and now it's $2,000. So this means that people in Part D will not be paying more than $2,000 a year for prescription drugs. This is like a huge benefit to patients. I mean, we talk about people with chronic disease, you're chronically paying. So to be able to have that reduced to get access to your medications and, maintain your quality of life because you have these medications at, a capped cost is really important to patients, and a lot of mental relief as well.
Totally. The average Medicare beneficiary takes many drugs. Folks on Medicare are either over the age of 65 or older or living with a disability. So these are folks who are likely taking multiple drugs, and to have that, if they're in the Part D program, to have those capped at $2,000 a year is quite a big deal.
Absolutely.
In fact, I just want to say I personally spoke with a woman who broke down in tears when she realized she would no longer, in her words, have to choose between taking medications and bankrupting her family. So that's just a real world example of what legislation can do for people.
Absolutely. Yeah. I mean, it's terrifying to have to choose between pain and your daily quality of life versus your financial health. And no one should be in the position to do that. So it's really good to see that the Biden administration took steps to reduce that impact. And then another one also with, capping the price of medications. So the IRA included a provision for Medicare Part D plans to charge no more than $35 per month for all covered insulin products. And it also limit cost sharing for insulin covered under Part B for $35 a month. And this is a huge relief. We've seen how insulin prices have skyrocketed and become really unaffordable for people. If you have diabetes, it's really not an option to not take insulin. So it's important to make this as affordable as we can.
Definitely. And of course, there are other parts of the bill that we believe have good intentions, but may not necessarily inure to the benefit of patients. For example, beginning in 2026, Medicare will begin to negotiate the prices of some drugs with manufacturers. While this will save Medicare, in other words, the federal government money, this will also have the consequence of reducing incentives for manufacturers to develop new drugs, which could result in lost opportunities for millions of patients.
Exactly. Drug savings sounds good, but sometimes it just doesn't trickle down to the patient. Like you're saying, it's not really clear how that impacts what the patient is paying. And if it also impacts drug development in the future, that could end up harming the patient. So I think this is another one of those examples where it'd be helpful to have more transparency on how these laws go down to the patient, because that's what we're always advocating for.
Absolutely. Absolutely. Not to go too deep on the IRA, but look, we're taxpayers, and I would love for the government to save money as a taxpayer, but I do have a personal stake as someone who badly seeks the development of new drugs, seeks, if anything, increased budgets for research and development, particularly for drugs that our community relies on, biologics, as we, it's not uncommon. In fact, it's very common for folks to be on biologics for them to work, and then the need to switch to different medications. So the more advances that can be made, the better it is for patients. And anything that curtails that is troubling, to say the least, particularly when the benefit on the flip side is not going to be a direct patient impact.
Absolutely. And, we have the inauguration coming up, so we are expecting the health policy landscape to change with the new administration. But as always, we will stay on top of it and, let our community know what impacts you and how to advocate.
Yeah, just a reminder of what you can do in 2025. Join the GHLF 50 State Network to lend your voice to key issues, stay informed through our newsletters, webinars, and advocacy updates, and share your story to inspire change and highlight real patient experiences. You can email us at advocacy@ghlf.org to get involved. Well, Zoe, thanks as always for another great discussion. As we look to 2025 and beyond, we want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.